talk about the chargeability in 2022 for employers under the paradigm we set up. And but I first wanted to talk about, and I didn't tell you about this because we just learned about this morning from in budget adjustment, your request for $12 million in expense money, and I think some more money after that. And we were, I think, all kind of surprised that the timing of this, given the fact that the unemployment system has had less people coming to it for help during 2021, excuse me. So let's just start with that. I don't know, both, I guess that's a question more for the commissioner. Welcome, Commissioner. Thank you for being here.
Good morning, everyone.
I don't have the chart in front of me, but I remember 12 and 7, and then 7, something else.
Yeah, I can certainly, if it would be helpful, I can either, I believe you all received our budget adjustment presentation. If not, I think Amanda had sent it on, but I can certainly share the screen if you would like. If that
that would be great. And we definitely got it this morning, and I remember getting it before then as well, but I paid more attention this morning.
Sure. Let me just pull it up real quick here. So we are asking for additional funds as I'm talking and doing this, so pardon the delay there. But I think the one thing that we would point out is that not everything in UI in terms of costs and function is built around the number of claimants coming in. So from that perspective, we have a lot of work that is still being done. Because it's budget adjustment, it also includes the first half of this year when pandemic programs, this fiscal year when pandemic programs were still in play. We get about $7 million a year annually from the federal government. In total for this year, it'll cost us somewhere in the mid to upper 20 millions to run the program. So when you back out the $7+ million from the federal government and you back out the additional, a little bit of additional CRF money we got, it ends up to your earlier comment coming in at about $12 million.
So did you, when you got your budgeted amount, I don't know if this appears as a line item that's just being adjusted by $12 million, or it's broken out into a lot of different things, but when you made the budget request last time, did you miss something that it was that far off? You didn't see these expenses coming? And I thought the feds usually pay for most of this administrative costs.
They, not during COVID, they haven't. They have paid for not even probably 10% of the costs to run the program. You should all be seeing my screen. Can you see that?
Not yet.
Oh.
I don't, anyhow.
Share screen. Let me know when you can see it.
Yeah, we got it. We got it now.
Okay. So we fully anticipated that we would outspend our budget request. We testified to that last year, knowing that we were going to be higher. However, we had the way the federal funding works is our budget runs in the federal program from October 1 through September 30. So we did not have an idea of how much would be allocated to us for the program year of October 21 through September of 22. So we testified that we weren't at a point where we felt like we had a good handle on the full cost of the program because we knew programs would taper off. We also didn't know if the federal government was going to renew any of those programs. So when we budgeted in coordination with the governor's office and the Office of Finance and Management, we we did not put in for what we thought the cost would be of the program till we had a better understanding of the federal participation level, and fully planned on coming back during the budget adjustment process to true up what our costs would be. So this was planned from the point we went through the budget process last year, and I believe we had testified to that as well. So I can walk through this. This is the presentation we gave to House Appropriations last week.
Well, if you could put up the next slide, at least we're not looking for a full presentation like you did.
So I'll skip through some of it.
And that is a good explanation. I guess I would almost jump ahead to my next question is, does this come down at all in the following year?
Yeah, so I can share a little bit. This is general budget of what we provided last year, but this kind of gave a breakdown. It's on slide 6 of where our heavy expenditures were. It also shows, let's see here. So in FY21, we had a total expense of around 53 million in terms of what we received, what we spent. We had a little bit left over, however, that essentially plays into some federal funds that are specifically designated for specific activities. So you can see in FY21, we received about $53 million. So this is the prior fiscal year. And then we spent about $47 million. You can see where some of that federal program money was. We received federal dollars to implement certain federal programs and run certain federal programs, but not a significant amount of money to run UI in total. So this was the prior fiscal year. Again, this talks about our current state. So you can see where we operated about a $47 million budget in FY21. We now are down to a $26 million program in FY22, and we'll be even further along in the next year. However, I think it's important to point out that there have been some systematic changes to the base of how UI operates to provide a more secure system and cleaner system to some degree, but with that comes cost. And so we will never get back, in my mind, to what we were originally spending on the program. This shares a little bit about where we were pre-pandemic. We had about 55 staff. We were 25 staff members short. So we were holding open about 25 vacant positions in UI due to funding constraints. And so, you know, at any time in 2019, our highest week was about 5,700 claims. Total number of claimants in 2019 was 16,000. Our federal base funding was about $6,700,000. The additional base actually includes, I think, some more modernization money at that time. So that's not typical to run a program. It cost us roughly about $10.5 million to run the program in 2019. We paid for some of that with some modernization money because we had some staff working on the modernization project. We also are able to cover some of this with our penalty and interest money that comes in. You can see in the post, and that's not current, but that's where we wrapped up 2021. We had about 120 staff. Our biggest backlogs and issues right now are in adjudications and appeals, mainly appeals. At the highest week in 2021 had 35,000 claimants. We roughly have about 60,000 claimants in total. Our total federal funding for 21, that goes to our base program. And so this came in October of 21. It will take us through September of 22 is 7.9 million.
So that's a lot to digest.
Yes, yeah. And I'm happy to answer questions.
No, that's okay. I'm just trying to understand.
Could we get this, Michael Harrington? Because we don't have it. I looked under documents. I didn't see it here on our website. So if you could send this.
Amanda, I'll have Amanda send it along.
Yeah. I've
I
seen
believe
it.
she sent it to the chair.
I've seen it before, but
Well,
I don't know how I got it. But so I'm just trying to understand, what is the total for FY22 if you get the 12 to $13 million in the budget adjustment request? How much is the whole program costing at that point?
In FY22, it's projected to cost us, and if you look at the page I'm on, you'll see the subtotal line.
Yep.
So all the way to the right, the total program for FY22 is $26,203,996. You back out both our federal funding as well as some CRF money, and that gets us to the $12,803,996. Our biggest costs are, we're still operating about 100 plus staff members. There's a whole lot of cleanup that has to happen now. We're going through multiple audits and reviews. We have to move claimants from one program to another program. We're going through multiple monitoring and closeouts of these programs. This is likely to go on for the next year and a half or more. So we will be running at an expanded level. I mean, we still have people who are filing in these programs or going through adjudications or appeals in these programs. So just because the program ended and we're not accepting new applications for these federal programs, they're still very much active. And now we're going through things like benefit adjustment, recalculations, void and reissue of payments, transactional work. We're going through program integrity work, fraud work. So that will again carry us well into the next fiscal year and beyond. Now, the number of claims coming through the door has significantly dropped off. We have already scaled back on our call center work. So at the height of the pandemic, we had 300 plus call takers through our Maximus call center. We're now down to 50 call takers. That's likely to drop again if it hasn't already. We had 28, I think at the height, fact finders that were helping with adjudications from our contracted service. We're now down to 15, I believe. That will drop again. So we're slowly backing off as volume allows, and because there is still an expectation that we manage both the backlogs, but also the volume of calls and people coming in the door. So
I think I'm at a level that's way below the detail you're talking about. But so I just look at this chart here. Does that mean the budget was $26 million and you only had 13 or so that you were able to account on, and therefore you need 13 million more in budget adjustment?
Roughly, yes.
So you had no funding from the state. This 13 million at the bottom, is that ARPA funds or general funds?
That's our budget adjustment request. So it'll be up to the legislature to determine where the 12.8 comes from. It is part of our budget adjustment request. Right. When we originally submitted our budget, there were no general fund dollars appropriated or requested for the current fiscal year.
Okay, so I think you requested ARPA dollars, didn't you? I mean, the governor in his budget adjustment request specifies what kind of funding it is, doesn't he?
Yeah, that may be a question for finance and management. I don't know whether or not they put this forward as one time or, in terms of general fund one time or ARPA. My understanding is I think it's in general fund, but I can confirm that.
Okay, I think we got something on that this morning.
Okay.
So let's move out. Let's say you're in a status quo right now in terms of what exists now for unemployment demand and unemployment insurance demand. Let's say that goes out a year and we clear up all this backlog. I'm just trying to get a figure as to what, without the pandemic, what's your budget needs that are, I guess I'm hearing, is all paid with federal dollars normally.
It is all paid normally with federal dollars. I think the I don't want to say the unknown, the things that are making our program cost more than it was before are things like moving our current mainframe system to a secure offsite location on newer hardware to prevent failures. So our data center was relocated at the early start of the pandemic. So we're now, and ADS has testified to this, part of the state's overall data center, as opposed to a room here at the Department of Labor. We've added things like identity verification and validation. We've made upgrades to our document retention. So everything was either stored in our network or through paper here at the department. So we are transitioning to electronic file document retention. And then with the fraud, there's a number of different programs that have been implemented through fraud. So for fraud detection and prevention. So there's a lot of technology that we've added that will all be part of the overall modernization effort in the coming years. But the cost to run those, for instance, we used Salesforce to create a initial claim application, which didn't exist before online.
So the bottom line is what you're saying is that even if I looked at FY19 or 20, as that's no longer an applicable comparison to what FY24 might look like, because you've added so many more advancements and other things. But all of that, both pre-pandemic and after pandemic, sounds to me like it could be paid for with federal administrative dollars. I guess that leaves me with the question, why this year there's a $12 million shortfall that we either have to go to ARPA dollars for or to general fund dollars for? Why couldn't we bill the feds for that?
We don't bill the feds. The feds articulate to us based on a set calculation what they will provide us in funding each year. So we don't actually provide a budget to the federal government. They tell us what our funding will be each year. So it's a calculation. It's called a resource justification measure called RJM. And it actually is based on prior year performance and claims, but they essentially preset what our allotment will be each year. So this year they've said you get $7.9 million. Unless we come out with additional funding opportunities, that is your full allotment for this current year. Okay. I expect that number to actually go down in the coming years. I don't expect it to go up.
Okay, let's move on. We weren't really expecting to do this. It just got thrown in our lap this morning. Do you have any questions on the budget and the shortfall and budget adjustment at this point for the commissioner?
I'd just like to say something to Michael, which is, I think this chart of the unemployment landscape is very helpful. I mean, it really puts, in a very easy to read way what we've experienced together. We feel like we're an extended part of your team in a way. And it's very, very interesting to see that. And I just would love to have you quickly remind us right now, how many people, and then I have a question about UI, because this is just one program within your department. So I guess I have one question for you, which is, well, I have a couple questions. One is, what is your current number of people on UI and who are claiming each week, and the, sort of right now, sort of rough notion. And then the second is this getting at the people who may be out because of COVID still, because we're still having a huge impact. The workforce is so disrupted right now. Childcare is so disrupted, but it's for very short periods of time while they're sick or while they can't go to work. Or are people claiming for those few days or for a week or 2 weeks that they have to be out? I mean, what's happening with that population? Because So I'd love some insight on that. So first, on how many claims we have roughly a week, and then second, how is this workforce that we know is impacted still, how are they using UI now that it's shorter term?
So, and I may ask Matt to jump in as well, but just based on the weekly claims data for the week ending January 8th, we had 4,000, roughly 4,500 claims paid out in continued claims. In total, if you count both the continued claims and the people who opened new claims, we had about 5,300 individuals involved in the unemployment insurance program. So, which is actually below average for this time of year, pre-pandemic. So, I mean, some of this is typically based on seasonality. So a lot of this is likely to be construction, or the granite quarries are our two main contributors during this time of year. I think we're usually around 5,500 to 6,000. Also, because of the warm weather, the layoff period, I think, has actually been shortened. So where we would see an uptick in applications starting the first week in November, it really took to the end of December before we were seeing significant layoffs. And so some of that was based on pent up demand for work, but the warm weather helped construction continue to go and helped the granite sheds continue to work. So that's a positive for those folks. To your other question about other people, so only if there's a separation of work would they claim unemployment. So are they being laid off, or are they being let go, or are they quitting their job? Then there may be the opportunity to be eligible for unemployment. And I say may because there's a lot of other factors in there, but in general, there would have to be a separation of work. If they are simply home sick but still employed, and if they are, if they have every intention of coming back, or if they're home to take care of a child who's out of school, they would likely not be eligible for unemployment benefits. There may be other benefits that they're eligible for, but not unemployment.
Yeah, I think that's our problem, is without paid family leave, I think there's a lot of income gap here, which is.
Yeah, and if you remember, under the Family First Coronavirus Relief Act, the very first that came out from the federal government, the feds mandated that employers provide 2 weeks of paid time if there was a COVID related reason. And so that sunset and obviously did not come back around. So that, that helped at the start of the pandemic, but that's not a opportunity that's here.
That is not there now, and it really is dependent on each employer doing a generous thing that may be a challenge for them given their impact on revenue.
Yeah, and I have not seen, so to your point, I have not seen a lot come through the door of individuals claiming essentially short-term unemployment with those circumstances. I'm sure it does happen, but usually if there's a groundswell, I would hear about it, or we would hear about it in the program, and I've not seen that. I am finding, I think, or hearing anecdotally that employers are trying to be as flexible as possible where they can. But again, if you're in the food service industry and you're not able to come in for a shift, then you're not earning wages. And so that I understand the challenge there for obviously the employer and the employee.
Commissioner, do you know, you mentioned that federal program that required 2 weeks of paid leave for COVID related absences. Do you know if the employers got reimbursed somehow, or did that have to come out of the employer's pocket?
I would have to, I don't know. I'm looking at Matt. He can't tell I'm looking at him. I'm not sure he knows. I'd have to check. I don't know if it was fully reimbursable or not.
Okay. Thank you. Let's move on. I told you I wanted to learn, close the gap on last year. One of the things we put in the bill was that employers could have their experience rating relieved, similar to what they did in 2021, but they had to apply for that relief. Do you have numbers as to how many did that?
Not in front of me. So this was, I think, a last minute request in terms of for the agenda. So we just need to connect with Cameron Wood, the director, to see how many people submitted an application. We did open the application period. It did close so that we could begin our work. As you know, we'll begin rate setting once we get 1099s out the door in the next 2 weeks. We'll begin rate setting that will take effect in July for employers. So, but we can certainly have Cameron come back in and talk about what that looks like.
Could you just, like by sometime early next week, send us a memo with the
Sure.
numbers?
Yeah, happy to do
that. Right number. I mean, I'm just wondering whether it's an added step and it might not have affected their ratings all that much. I'm wondering how many took advantage of it and whether there was any, we were trying to protect jobs to make sure to encourage employers to offer the job back. So I want to know how successful that was.
Yeah, I think the one caveat to your point, and I know this was very intentional on both our parts when we created the program, is that it does put the pressure on the employer to offer their job back too, which was a part of the original legislation. And I think that there were layoffs, but I think the challenge would be in many of those cases, employers either didn't have intentions or were not able to staff back up and offer the job back. But that was a defining piece in that, and I think that may have impacted how many people.
If you could touch upon that in the memo,
sure.
To see how that program worked. So I wanted to move on to minimum wage, and I guess Matt probably can help us here. I am, and I know other members of my committee are potentially interested in moving a bill that we have in our committee that would complete the increases in the minimum wage that we had passed and the governor vetoed through 2015. I guess the basic question I'm trying to ask, I don't know if you can answer it now, has minimum wage become irrelevant at this point? Because, that may be the numbers, but if we're going to have a minimum wage bill and it's stuck at this level and we get to 2024 and our minimum wage is at $13 and everybody's paying $16, then unless we change the law forevermore, we're going to be stuck with an inflationary increase that leaves minimum wage way behind where it was because of the changes in the marketplace. I think that's enough, Matt, for you just to start talking and let us know your thoughts on this.
Matt, go ahead.
Great. Good morning, everyone. For the record, I'm Matthew Bearwitz, Director of the Economic and Labor Market Information Division with the Vermont Department of Labor. It's a pleasure to be here. Thank you for inviting me. For those who've been in this committee a long time, I come in here and I talk about the economic theory associated with the minimum wage, and I'm happy to continue that discussion. But in essence, just kind of shortcutting right to the chair's questions or points, any sort of price control, whether you're talking about a price floor or a price ceiling, is only relevant if it is binding. That's the term we use. And in the case of a price floor, which is what the minimum wage is, you're saying you will not pay less than this. A non-binding price floor is irrelevant. And so if the market is already paying way above that, or any amount above it, doesn't have to be way above it, no need to exaggerate, then it is a non-binding price floor, and therefore it's not having an impact on the market at all. And so I think if we've had long discussions about this, and just as an aside, when all that's going on with inflation, with the federal activities and programs, I actually thought coming in this legislative session that there would not be discussion about minimum wage, because I figured it had to be the 100th most important topic on the list, and at least 99 other things had to be more important than minimum wage, considering the challenges that employers are having filling jobs right now, and what's going on with wages and starting pay and the competition for labor. And so I guess I was wrong. I should not have assumed that minimum wage was going to be off the table for this legislative session. So I haven't given as much thought to it as of late, but I can say that, taking a look at some occupational data, unfortunately, we don't have person level data, but from an occupational standpoint, we track and estimate how much each job in the Vermont economy pays. And we don't look just at average and the mean. We also look at the 10th percentile up to the 90th percentile, again, for every occupation in the state of Vermont. The most recent data we have available to us is 2020. In March or April of this year, we'll release 2021 data. But for right now, what we have available to us is 2020. And so this is data that would have been compiled compiled and released just before the pandemic really took hold. So grounding us in where we are at. So 2019, we had strong economic conditions. There was a lot of competition for labor, a very low unemployment rate, low number of claims, similar to our situations right now. So a lot of this is actually data collected and compiled in 2019 that ultimately gets adjusted to be reported as 2020 wage data. And if we look at that wage data by occupation, we see that the 10th percentile of all occupations in the state of Vermont earn $12.40 an hour, meaning that 10% of every jobs in the Vermont economy earn less than $12.40. I'm going to say that again. 10% of every job in the Vermont economy in 2020 earned under $12.40. At that time, the minimum wage was $10.97. So if we're talking about a price floor, I think this would be a strong case to indicate that there's not a lot of activity that would suggest that this is a binding price floor. So to your point, in these economic conditions, I'm not sure how much impact it has. You've heard me argue before that this is not necessarily the best way to go about helping individuals. Sometimes good policy or good economics does not mean good policy, and vice versa, right? Good policy does not always equal good economics. So I understand we all have different disciplines and constituents that we're serving here. And so for me and my standpoint, what I'm just here to talk about is, anything that helps you in the decisions you have to make and help you be better informed about the Vermont economy. So I think that's what I would say in opening to your statement.
Okay, so it sounds like one of the things I'm hearing is that if the minimum wage levels hadn't been irrelevant already, they really are now. They're non-binding and they don't produce any help for people. So, and just to be clear, one of the primary goals of having is that to the extent when we pass minimum wage, we had numbers from JFO, we had numbers from you, it did impact a percentage of the people, whether it's 5% or whatever, and it helped possibly those people slipping below the minimum wage. It seems to me that we have to raise the minimum wage by significant jumps beyond inflation over the next few years or right now, just to maintain its relevance even for 5% of the people. If we just want to keep the status quo of the percentage of people that get helped by there being a legal minimum wage, we've got to do something about that. Otherwise, we're just left with a law that doesn't affect any people, and it goes up year after year by a percentage and still doesn't affect any people. So it may be a question of philosophy, whether 5% of the people is enough to help, but it seems like it. I mean, you don't have the new statistics, but even on the 2020 statistics, it seems like there was a gap between our minimum wage and it being, as you say, a non binding wage, whatever.
Yeah, and again, I'm not in public policy, and so I tip of the hat to all of you who are.
No,
And we've discussed this, and my point being is like, you have to wonder if there is a better mechanism, I guess, from my standpoint, because if I look back over the years of where there has been legislative activity, and I think we all wish that this world was as simple as if we just pass this law, then at which point people will have the income they need to make their basic needs met, right? But unfortunately, the outside world is much more complicated than that. And so I already start in our previous conversations have focused on, well, you may be helping 5%, 10% of workers at that wage level, but there's also people at the margins that are being, like, in essence, being pushed out of the labor market because they are not employable at that wage rate. So meaning working with individuals at all skill levels and understanding that there's potentially opportunities that are being therefore removed from individuals who are now finding themselves outside the labor market and not able to enter because they have such a barrier to skills, whether that being hard skills or soft skills. And so the Department of Labor, that's one of our trademarks is we work with individuals, we try and get them upskilled, we try and get them prepared for those discussions. But ultimately, if you're an employer and you have a small shop and this is how you make your livelihood, at a certain point, it's just like I can't afford to take the risk to hire somebody at that wage level if they don't even have the skills. They might do more damage than good. And so, we start having to counterbalance, like, how many people are being helped versus how many people are actually finding themselves out of the labor market and not employable at the wage rate that is the minimum.
And whenever we talk about minimum wage, we look at both sides of that equation and try and balance. I for one readily admit that there is an effect on other workers as well as those people at the minimum wage.
Right.
Raised as well. I don't hide from that fact at all. And I think we have a big problem with income inequality in this country. And this is just one tool. I don't pretend in my wildest dreams that this is the only solution or the best solution, but I think it is a tool in the toolbox. Senator Clarkson.
Yeah, Matt, thanks. I appreciate it. And I'm just a little confused by your term non-binding because they are bound by law to not pay less than that. So minimum wage is in fact a binding requirement of employers to not pay less than that. So I don't understand fully your non-binding words for minimum wage. But that being said, is one of the challenges that minimum wage no longer is the livable wage, that if we set the minimum wage at what is the livable wage, that would have more weight and would carry real impact or have real impact?
That's a question I guess I haven't given much thought to about how we approach this problem so differently, or this discussion. And so first and foremost, that language on binding, what I'm talking about is the economic term of the market clearing rate is above the floor. So maybe from a price ceiling point, it's more better example is like you cannot sell a car for over $10 million. Well, you look out there, there's no car being sold for over $10 million. So you could pass that legislation, but it's non-binding, meaning it impacts no transactions on that. It's a price ceiling. And a price floor where it's like, okay, you can't pay less than $12 an hour. And then you look in the marketplace and we find 0 jobs that are paying under $12 an hour. Therefore, it's a non-binding. It is legally binding. That's in the legal world, that yes, it's a binding constraint of employers, they must pay this. But from an economic standpoint, when we look at what jobs are being paid, what the market rate is for going labor, then it's non-binding in that all the jobs are already paying above that. So you think like minimum wage in New Hampshire, right? New Hampshire's minimum wage is the federal minimum, the minimum wage, whatever that is, $7 an hour or something. But that's a non-binding. Yeah, but that's a non-binding price floor. And I think to New Hampshire's point, they're like, it doesn't matter what the minimum wage is. We're going to let the market figure out what it is. And if it's $15, if it's $16, if it's $17, we're going to let them all sort it out. Because I do disagree with the chair on his point that this is a tool in the toolbox to fix income inequality. There's no evidence to indicate that income inequality has been improved in the last decade with the increases of minimum wages in the states that have done it, because the wages ripple up, and as the wages of the bigger population in the labor pool increase, so meaning your frontline staff, you as a business owner are taking on more risk and have to be compensated more for that risk, and therefore are building it into your prices and in building it into your profit for the stock that you've invested in. And so I don't see it, and that process actually increases greater than for the per individual across the board. And so I do not see this as a tool for eradicating income inequality.
Not even a livable wage?
Oh, a livable wage?
So, I mean, I'd go back to my question to you, which is, you know, is the relevancy of the minimum wage, because it isn't any longer the minimum amount people need to live on, which is what Roosevelt established it to be. So if we actually set it at the minimum amount people needed to live on in Vermont, it would be much more like $18 or $19 an hour. And so I guess my question to you, and because I don't think our JFO basic needs thing has any relevance either here. I don't know where I mean, to me, you know, you can't, for me, a minimum wage needs to be able to afford a 1-bedroom apartment for a family with, it needs to be able to afford the minimum amount needed to live on wherever they're living. And right now in Vermont, that's higher than our basic needs or our minimum wage. It's a livable wage. And so would that help establish, would that help reduce the gap, do you think, on income inequality?
I don't see it, and I'm just trying to play this in my mind as we're discussing this, so that's always risky. But in essence, if you were able to hold the entire economy still and just change that one price, perhaps. However, we know that as soon as you change that price, the wages are going to change for every other occupation. That means the prices for every good and services are going to change. And that means whether you're building a house or you are changing the tires on a car, all the prices are now gone up. And so you're going to be, like, in essence, chasing that, because if you set the minimum wage at $17 an hour and then now a year later all the prices adjust, well, now $17 an hour isn't going to cut it either, because now the competition for goods and services again taken over. And unfortunately, this is where my market mind takes over, where it's just like it's way too complicated to think that we can change one price and everything is just going to be okay for everyone, because everything else is going to react in accordance to that, including the profit that employers take because of the increased risk associated with their endeavors. But I could see that eventually, if you make a minimum wage so high, you will ultimately push out certain industries that they couldn't even deal with that here. And then you start having a different problem.
So wearing your economist hat, how do you account for Vermont paying across the board 20% less in salary than any of our neighbors per job? Almost every sector we underpay. How do you account for that then? And where does that figure, and how could we impact that? I mean, I'd be thrilled if we could bring across the board pay up 20% to be comparable to New York, Massachusetts, Connecticut, Maine. I mean, we underpay 20% in this state. And how can we, that would affect income inequality also, if we could ever get at that.
I don't accept the premise as being 100% true that we underpay on 20% of all our jobs. There are probably certain sectors we don't do as well, but New York is going to be heavily influenced by the city, and Massachusetts is going to be heavily influenced by Boston. And so they have that metropolitan area that is going to be paying higher. But if you look at us relative to the other states around the country, I think our income, we're around like 14th to 19th, depending on the income metric. So we are in the top half of the country in terms of earnings and income. And so, I don't know. Yeah, to your point, I don't know. And I think there's a lot of, this is why I wasn't thinking minimum wage is going to be such a conversation this session, because we're bringing in workers that now can work remotely, right? So we're bringing in California wages and they're residents of Vermont, right? And how is that going to impact the economy? Those are the questions that are kind of making me really scratch my head and wonder how does this all play out right now? Because in many ways, technology is leveling the field for certain occupations. So if you want to get that 20% increase for, say, computer programmers, it might just happen naturally because computer programs who actually used to work in Boston now live here, but their employer is still in Boston. Yeah, I wish it was very simple.
Okay.
Unfortunately, it's not.
I think we'll have you back, Matt, because I think we're going to probably move forward on a minimum wage bill, despite the fact that there's other things we can do as well. We'll try and do that as well, but we want to make the minimum wage bill relevant, at least for the few people that are not getting paid minimum wage. And we will look at how it adversely affects other people who have difficulty in entering the labor force. Senator Rahm, we're going to have to wind up. We're over time, but go ahead, please.
Yeah, I mean, before we wrap up, I wanted to take a moment to talk about any thoughts or ideas you have looking around the country at emergency wage replacement in the ongoing pandemic experience. I want to let my fellow committee members know I did ask Damien to look into this from a legislative council perspective, just to see what is emerging. As we know, the federal government is not necessarily tying this to emergency unemployment, but that we know that for both employees and employers, they're really, hoping to get back into the workforce quickly without creating a downward spiral in terms of childcare and other long-term economic supports. And so are you looking around the country at emergency wage replacement in this moment?
Yeah, we are not.
Right.
I thought I had asked somebody. We'll have to go back to
We
to
did.
look into that and to check. I don't know if it was you, Commissioner. I know you said you were going to talk to your fellow commissioners whether there was any activity in other UI programs or elsewhere. I may have also asked Damien too, but I mean, it's theoretically possible. That's why I asked the question of the commissioner whether on the federal level, when they did something with the 2 weeks of paid leave, whether the federal government reimbursed through tax credits or something the employers who paid out that money. I mean, it wouldn't be beyond reason to consider a state program like that with all our ARPA dollars or something to get through this COVID Omicron period where people can't qualify for unemployment under the unemployment laws. Not only with the commissioner, one of the things he probably would have mentioned if he had more time of all the other restrictions is that you have to be available and ready to go back to work to get unemployment. So if you're sick, by definition, you're not looking for work and you can't get benefits during that period. So
Yeah,
Right.
You bring up a great point, and I agree with the able and available piece, which makes it difficult. The things that immediately come to mind as we're talking about this is whether it's Omicron or whatever comes after Omicron, it could be, we'd like, there may be a desire to look at it as how do we get over this current surge? We will be over it probably before any program could be implemented, but there will be another one likely. I think you would probably see some type of increased exodus from the workplace if people knew that they could more freely leave their employment for a short period of time, whether it's for childcare reasons or to care for a loved one or because of a concern about exposure or quarantine or isolation. So you would actually, I think, pull more people out of the workforce than are currently in it. I think you then have, for instance, I have friends who have children in school and they kind of have these rolling going remote in the school system. So they're out for 2 weeks due to COVID cases. They go back for 2 weeks. Then there's another COVID surge that kicks them, so you would have people going on and off this benefit on a regular basis. So what could be 2 weeks could be 2 weeks on, 2 weeks off, 2 weeks on, 2 weeks off indefinitely. And the cost for that program, I think, would quickly outpace the available funds that you have. So just things to consider as I'm just thinking of these off the top of my head.
Yeah,
But happy to come back and have a deeper conversation about it.
thank you. I appreciate that. There clearly are challenges in the timing here. But as food for thought, I know several of my committee members will like to hear this, is it demonstrates the need for a sensible paid leave policy in this
Yep.
country compared to every other advanced country in the world. And unfortunately it was vetoed. Our attempt at that was also vetoed. But I don't think we'd be in this situation right now if that bill had become law. So I'm going to get off my pedestal, but I do appreciate you guys coming in, and we'll be probably hearing you once a week for a while. Take care. Thank you. Bye-bye.
Thank you,
Thank you
everyone.
both.
Thanks, committee. We'll see you on the floor.